A new poll reveals that a majority of Americans agree that it's time to accept COVID and move on. I'm not accept. I reject COVID, but I'm ready to move on. The Monmouth University study found that 70% of those surveyed agreed with the sentiment that it's time we accept that COVID is here to stay and we just need to get on with our lives.
And the breakdown by party lines is probably what most of you are expecting. A total split, a whopping 89% of Republicans agree it's time to get on with our lives, compared to 47% of Democrats. Now, 71% of independents agree it's time to move on, according to the poll. Here to weigh in is Democratic strategist and owner of JC Strategies, Jennifer Holdsworth-Karp, and Amy Tarkanian, a Republican strategist and former chairwoman of the Nevada GOP. Welcome to you both.
Good morning.
Good morning.
So, Jennifer, if all Republicans want to move on and most independents and like half of Democrats don't, the holdout Democratic political officials, like the ones running the city I live in currently, don't they risk some political losses if they cling desperately to the war footing against COVID at all times?
Yeah,
so
I think I'm going to.
That's what I'm looking for.
First of all, I'm going to say that unfortunately we cannot conduct public health by poll. I too am done with COVID, but obviously don't want other people to catch it. Look, I think that you even saw a lot of the governors, including Democratic governors, this past weekend at the NGA, really appeal to President Biden and say, look, we've got to start living with this as endemic, as opposed to a full-blown pandemic. But that's a hard bridge to cross when we still have more than 3,000 Americans dying every day, and 3,000 out of 330 million doesn't sound like a lot on the daily, but really is. Unfortunately, we arrived at this place where it was all or nothing, and the parties went to their corners. Now, I'm not trying to portray a false equivalence here. There was a massive, massive amount of misinformation that was coming out of the right, very broadly, a very generalized statement. And Democrats, especially in the states, were trying to do the right thing at the beginning, and they were meeting resistance sort of every step of the way. Now we've gotten to this place where it seems, as it pains me to admit it, that Democrats have dug in their heels and are not actually following the science themselves. And that comes after just wild and conflicting guidance from the CDC after the last couple of weeks, that it appears that most folks have thrown up their hands. There's a lot to be said about following the science here, but we have to actually do it. And at this point, with the virulency of Omicron, it appears to be that we're heading into endemic territory. So we have to acknowledge that and move on from some of the draconian restrictions that we're currently seeing.
And Amy, what is the Republican plan that you're seeing to capitalize on this divide?
Well, it's refreshing to hear Jennifer actually admit that the CDC has been a mess. And I would agree with her in that I think that's actually what's caused a lot of the turmoil and confusion from the get-go. We gave everyone grace at the beginning because this was something new. But then as our supposed leaders and people who were in the medical field were giving us conflicting information, it set people into a state of panic. Yes, I know people who passed away. Yes, I myself, as I've told you time and time again, I've had COVID 3 times, and I've also been fully vaxxed, and I just recently got my booster. You know what I would wish? If this were as serious as it has been portrayed and told to us, which I do believe it's serious, why isn't it just the same worldwide? I understand each nation, each state wants to have their own sets of rules and laws, but if science is science, for example, starting today, if I want to go to Spain, which my daughter now wants to study abroad in Barcelona, in order to go to Spain today, I would have to have my booster. But yet you can go to an adjacent country and you're free to roam around without having to show any vaccination proof. It's mind-boggling, and I've got friends who are still holed up in their homes, terrified of getting Omicron because it spreads so easily, and they're healthy as can be, but yet they're still choosing to live as hermits. And they are Republican, so it's not just Democrats who aren't ready to move on. There's a hesitancy, and people are fearful.
Some other interesting notes from the survey include 52% who said they support instituting or reinstituting face masks and social distancing guidelines in their home state. Over my dead body, down 3 points last month. And 27% of those surveyed said they thought a return to normalcy may never happen. Well, and I understand why those people feel that way, because the football has been, snatched away from us as Charlie Brown goes to kick it so many times. Part of that being we have, these two waves that set in when things looked good. As vaccination was rolling out, everyone was getting vaccinated. End of Delta, things looked good. Then Delta came along, and then this happened again with Omicron. Look, so I get it, and yes, the deaths are still far too high in many states. But Jennifer, it's large, by and large, that's unvaccinated people. It's people who refuse to get vaccinated, and I wish they would get vaccinated. I try to encourage them to every day on the show. But at some point, is it fair to disrupt everyone's lives, to disrupt our children's lives, who are largely protected from the worst outcomes of this disease indefinitely because some people won't get vaccinated? I think that's their choice, and they have to live with the consequences, and the rest of us can't be held up by that forever. And I think Democrats risk making a lot of people like me very mad because they're not just willing to concede that.
Well, we've refused to look at this from a 50,000-foot perspective. Everything has been in the immediacy. How do we respond to the immediate crisis? One of the conversations that's emerging from this is, what are the long-term effects of COVID? Now, we've heard lots of conversation about what are the effects of the vaccine from the unvaccinated community, but you're seeing some incredibly detrimental long effects of catching COVID. There's organ damage. There's a lot of other autoimmune responses that are happening as a result of catching COVID. So for those who are still very hesitant to go out and catch it, even though they are vaccinated and boosted, like myself, I encourage everybody to do so. I support a lot of the mandates because it makes sense for us to actually move forward out of this so that we are not straining and overwhelming our healthcare system that has been on a war footing for almost more than 2 years now, as we enter our third year of this pandemic. We need to be very realistic about what this is going to do to our health as a populace and our healthcare system long term. I hear a lot of people talking about what the potential effects of a vaccine is, but not enough people are talking about what are the long-term effects of catching COVID itself. Now, I believe that it is a very good compromise to move forward with masks in several places. I'm sorry, Robbie, I happen to disagree. We have seen over and over again that the correct mask, I don't want to come out here and say your cloth mask from a department store is going to work here. No, you need an N95, you need a KN95. Let's get back out into the world. Let's wear our masks. I believe schools should remain open, obviously. There's still a huge debate about whether masks should be worn in the classroom because the incidence is so low in children. The question is that what about the teachers? And this has become a huge flashpoint about the teachers union, but really, if we are interested in protecting our populace and protecting each other, what is going to encourage the lowest outcome of the number of people catching COVID?
But why can't they
just... I
just
don't believe that we need to hunker down, but we need to have a compromise here. It cannot be all or nothing.
But I don't know if the compromise is everyone wearing the giant disruptive masks on their faces all the time. If teachers are concerned about it, they can wear them. But kids have not seen their teachers' faces in years. I'm starting to where I'm learning more about possible difficulties young children learning to read might have. I mean, you can't tell me this is not going to have some kind of social effect, a possible learning effect. It's hard to understand people. Randi Weingarten took her mask off at an event when she was trying to be heard, and they said, "Why'd you take your mask off?" She said, "Well, nobody could hear me." Well, you think that could be an issue in the classroom? What do you think about this, Amy?
Well, I am 100% against mandates. I am all for choice. One, I've already said I am fully vaxxed. I have a son who has a medical exemption because he had a stroke at the age of 5, so blood clots are a possible side effect. I also have a friend whose husband had no underlying conditions and was in great health and actually passed away from the vaccine. So there are different scenarios for different people. So to each their own on making sure that they make the best choice for themselves. I am 100% against the continuation of masking our children. I was shocked to read a San Francisco Chronicle article the other day, which we all know is a city that veers very hard to the left. And it was actually saying it's time to take the masks off of our children. And the stat was interesting because one death is still too many for our children. However, they say that a regular influenza season, except for last year, you have a loss of life from 200 to 1,200 kids. And then from the time the pandemic started with COVID-19 up until now, we've had roughly 900. Now, I know that sounds a lot. Like I say, one is too many. But in the larger scheme of the percentages, when you're looking at the medical field, it's not.
Right. Well, Jennifer and Amy, thank you for joining us.
Thank you.
And we will have more Rising right after this.